with Zin Insurance Agency, and welcome to our very first live Facebook offering on Medicare education and updates. Tonight I want to talk to you about some Medicare changes that have happened starting for the 2021 year. Now keep in mind, some of the information that I'm discussing with you tonight does not include some of the changes that have recently happened with the new administration when it comes to medical care. A lot of those changes for the medical care with the new president really are more affected for individuals, not so much Medicare, for those who are on Medicare. So let's kind of dive in, get some questions. I'd love to share your thoughts. If you have a question or a comment, please let me know. I'll be happy to discuss any questions that you have as we go along the way here. So let's kind of get started. I'm going to show you some different infographics for us to get into so that you're able to see a little bit more of a deep dive into some of these programs going forward. All right, so let's see here. Let's go ahead and I'm going to share my screen. Let's see. Sometimes things don't want to share like you want it to. All right, super fun. Okay, so some of the Medicare updates that we're talking about. So Medicare today, 63 million individuals in the U.S., or approximately 1 in 4, are covered by Medicare. 26 million people have enrolled into a Medicare Advantage plan. That's quite a bit of statistics and people aging in on a yearly basis. Part A updates. So keep in mind, when you go on to Original Medicare or Medicare in general, you have Part A and you have Part B. A are your inpatient and facility coverages. So when you have worked either 40 quarters or 10 years into the system, you have paid Medicare taxes, you automatically are entitled to Part A. However, if you have worked fewer than 40 quarters, you can buy into Part A. And again, Part A is inpatient and facility coverage. So let's get into what that means. So working 40 quarters, if you've worked less than 40 quarters, you can be charged $471 a month for Part A. If you've worked 30 to 39 quarters, you can be charged $259 per quarter per month to have Part A. And if you've worked 40 or more quarters, you will not be charged for anything going forward on that. So let's see here. Let's also show you here where I can show you some of this live information, making it easier for us to take a peek at. Okay, so now I want to show you some information on going forward. Okay, so inpatient hospitalization. So when you first are hospitalized on an inpatient basis, on a calendar year basis, there is an initial deductible to meet under Original Medicare. Keep in mind, I'm going to be talking to you briefly about in Medicare Advantage programs that have a little bit different set of rules in itself. So when you go in for an inpatient hospitalization, there is an initial deductible to meet of $1,484. That is a $76 increase over 2020. The first 60 days, you are not paying anything. Then days 61 through 90, there is a per day copay of $371, and that's a $19 increase from over 2020. Anything over 91 days, Medicare says we will cover all but $742 per day, which is up to a lifetime max of 60 days. So as you're going in, there are certain days or certain things that Medicare will cover. So they have what's called an all but definition. We will cover all but the daily charge. So that is when it's advisable for you to get either a Medicare supplement, or we'll talk to you in just a moment about Medicare Advantage plan that covers those gaps that original Medicare does not cover. Skilled nursing, so if you went from a hospital and you're not able to stay in a hospital, but you're definitely not able to go home because you still need care, you are then sent to what is called skilled nursing. So the first 20 days that you go to a skilled nursing facility, you do not pay anything. So Medicare covers those services at 100%. Now, if you're there days 21 through 100, Medicare says we will pay all but $185.50 per day for your care from days 21 through 100. If you are in a skilled nursing facility longer than 100 days per calendar year, you are turning around and now you're going to be responsible for all medical costs thereafterwards. Okay, so let's kind of talk about some of our Part B services or our Part B updates. Now, Medicare Part B is your outpatient and your doctor coverage. Keep in mind, I've not discussed anything about prescription coverage. It's strictly outpatient and doctor. So doctor can mean primary care, or it can also mean your specialty visits thereafterwards. So in order to have Medicare Part B, you have to enroll in Part B. And enroll in Part B premiums are based upon your adjusted gross income, whether you're an individual or a married, from 2 years previous taxes. So if you are aging into Medicare in year 2021, Medicare is going to take a look at your 2019 taxes to assess what your premium is going to be. The minimum is $148.50 per month, and you can have that either deducted out of your Social Security check, or it will be billed directly to you on a quarterly basis. Now, you have the option of contacting Social Security and asking them to either put you on a monthly bank draft option, or they will also allow you to pay your Part B premiums under a credit card, which is very nice. Not a lot of people know that. Now, if you are taking a Social Security check, your Part B premiums are automatically deducted. Now, keep in mind, Medicare, due to the Affordable Care Act, has made Part B premiums a sliding scale. So the more that you make, or the more that your adjusted gross income is within your household, whether you're single or married, you will pay a higher cost going forward on that. And what I will do is I will also publish some income, it's called income related monthly adjustments, called IRMA. So depending on if you make $88,000 to $176,000, you'll pay a minimum of $148.50. Then there's in different brackets, $88,000 to $111,000. If you're a joint, it would be $176,000 to $222,000. If you are an individual, then it goes from $111,000 to $138,000, $138,000 to $165,000, $165,000 to $500,000, and anything over $500,000 in adjusted gross premium as an individual, or over $750,000 as a joint, you'll be paying $504.90 a month for Part B alone. So, what are some of the deductibles that you can incur if you go on to Medicare? Again, this is original Medicare without any additional supplemental or Medigap coverage. So the first time that you go to the doctor, you will have to pay a $203 calendar year deductible to go see a doctor. And that's whether you go and pay towards your primary care physician, or if you go see a specialist. That's a $5 increase over to 2020. Now let's see if I'm going to open this up and ask for any questions at this particular time. Does not look like anybody has any questions for me. Okay, so now we're going to start to get in, and we're going to start talking now about Part D updates, so prescription drug coverages. Now, keep in mind, Medicare A, Part A and Part B does not cover prescription drugs. You have another hand in Medicare, which is Medicare Part D. Okay, so Medicare Part D is the only one that makes sense out of the alphabet soups. D equals drugs. So 2021, there is a standard benefit. The deductible last year was $435. This year, the deductible is $445. So you could be responsible for the first $445 in the retail cost of the prescriptions. Then you can pay different costs for generics, brand names, non-preferred drugs, depending on where your drugs are in the therapeutic class. So after the $445 deductible, then you have what is called the initial coverage limit. So from 0 to $4,130 is what they call the initial coverage limit. During that time, you are able to pay copays for your prescriptions. Tier 1, Tier 2 generics, brand, non-preferred, specialty, and high dollar specialty from there. If your retail cost of your drugs, and that's cumulatively, that's not just cost per drug, it's all drugs together that you are currently taking. If your drugs exceed $4,130, then from $4,130 to $6,550 is now called the coverage gap. During the coverage gap, what happens is that you no longer get copays unless you purchase a standalone prescription drug plan, and some plans offer generic coverage during that time. You will be paying a percentage of the cost of the drug. Typically, it's 25%. If you do hit over $6,550 in retail cost of prescriptions, again, that is not what you're paying in copays, but the retail cost of the drug. Then you have hit what's called the catastrophic phase. During the catastrophic phase, Medicare steps in and says, okay, we're going to pay 95% of the cost. You're going to pay 5% or no more than $3.70 for generics or $9.20 for everything else. That's usually a 10-cent increase on the generics from 2020 and a 25-cent increase from all other drugs from the year 2020. So those are some minor new changes going forward on that. Okay, so let's talk a little bit about senior savings models. So it allows Part D plans to offer a month's supply of a wide range of insulins for no more than a $35 copay each. Keep in mind this is dependent on which insurance carrier, should you decide to get an insurance, which most people do, whether you go with original Medicare, a supplement, and a standalone prescription drug plan, or let's also talk about the Medicare Advantage plans, which we'll talk about in each shortly. Participating plans vary by state, and they also vary by county. So you could live in Texas as an example. It could or could not be available to you, but you also have to be mindful of what county that you live in as well. Insulin must be covered by all plan formularies, but it is up to the insurance carrier where they put those drugs in the formulary listing. So please keep that in mind when you're taking a look, when you're shopping for formulary or your insulins during this course of the year. So let's also talk about now, we've talked about original Medicare. Let's now talk about Medicare Advantage updates. So Medicare Advantage is another type of a Medicare program that you can take. So when you're thinking about Medicare, when you're going on to the first time, there's really two avenues to go. Original Medicare plus a supplement and a standalone prescription drug plan, or you go the Medicare Advantage route update. So Medicare Advantage programs are offered by insurance companies, and they offer a variety of different plans and different types of networks. Most of the time, you're going to see networks, either a PPO, which is a preferred provider option. The opposite side of the spectrum is an HMO network, which is and then you also have a few hybrid networks called EPO or point of service networks. And we'll get to that here in just a second on what those networks do contain going forward. So some of the things that have changed from an overall standpoint from year 2020 to 2021 is that the highest maximum out-of-pocket, or what they also call MOOP, M-O-O-P, maximum out-of-pocket limits, increased to $7,550 after being capped at $6,700 for the last several years. So you went from $6,700 max out of pocket to now the highest maximum that insurance carriers can offer is $7,550. Now, keep in mind, there are insurance Medicare Advantage programs that still offer a maximum out of pocket of $6,750, and there's also some other ones that offer lower out of pockets. Maximum out of pockets or MOOPs vary by plan. So keep that in mind. Vary by plan, vary by carrier, vary by state and by county. Qualification updates. Let's talk qualification. So individuals with end-stage renal disease, or also known as ESRD, can now enroll into a Medicare Advantage program. That's fantastic. Beforehand, you had to be a special enrollment where plans qualifications now include enrolled in Part A and Part B. You had to live in the plan service area or county, and you now can make a better informed decision. So that kind of goes over some of the overall view when it comes to our Medicare options. I'm going to kind of open it up for some any live questions or concerns. Are these comments only for Advantage plans? No, these are not all for just Advantage plans. Some of these are for Advantage as well as original Medicare options. All right. We also had another question on income-related monthly adjustments. Okay, so unlike Part B, Part D premiums are also based on an individual's adjusted gross income from 2 calendar years ago. And additional costs can add on. So if you make above $88,000 or $176,000 as either a single person or as a married filed jointly, the higher income that you make, you will also be charged not only Medicare Part B higher premium, but you will also what's called an income related monthly adjustment, or what they call an IRMA penalty, when you get a prescription drug plan. So again, I can provide you guys charts and information on there so that you can see what those costs are going to be, which we'll publish at the end of this live event going forward. Let's see here. What are some other questions that we had? Those are really some of the other questions that we've had at this time. We would like to encourage you guys. We are going to be doing these educations once a month, so I would love to encourage you guys to come check us out. Next month we are going to be having a different topic, so we want to be able to make you a better informed consumer when it comes to going with these options, whether you go the Advantage route or if you go with the original Medicare route. We also are going to have more questions if you have questions concerning prescription drugs. A lot of times we also have people, what they will do, they have a lot of questions when it comes to going to get a prescription. Well, can I go use GoodRx? Can I use Single Care? Can I use coupons? May I use discount cards? So how Medicare is initially set up is that when you go in, if you have insurance in addition to an Advantage plan, if you choose an Advantage plan, or if you choose a Medicare supplement plus a prescription drug plan, many of the discount options like through GoodRx or Single Care, those cannot be used in conjunction with your standalone prescription plan or your Medicare Advantage plan. If you choose to use those type of programs or those types of coupons or discounts, it is advisable for you need to say that you're going to be paying cash for those particular prescriptions, because Medicare, your insurance, Medicare does not allow coupons or discounts. So if you are a private pay or a cash paying patient, then you are able to use those coupons at your leisure. Medicare does not allow you to do both the coupon as well as your health plan or your prescription drug plan at the same time. How these discounts are set up is that it gives the consumer allowed to continue to take their prescription. They are able to typically use that prescription, but then on the back end, the medical providers or the pharmaceutical providers bill the insurance carrier on the back end. Well, with Medicare, Medicare says we don't allow that any type of billing on the back end, so that is why they don't use that. So if, again, once you do go in to go get your prescription, it's really important for you, if you do use it, before you go into the pharmacy, do your homework. Go check out Single Care. Go check out GoodRx. There's also, you can Google the name of the manufacturer plus coupon card, discount option. There's a number of different ways to see. The pharmaceutical companies also have additional programs. There's even nonprofit options for you to consider if you're taking extremely high dollar cost medications that you are not going to be able to affordably take care of, that there are other options to check out. Not to mention, you can also check with your doctor and say, hey, the prescription that you're providing to me is very expensive. Do you know of any medications or assistance programs that you know of that I can get into that can help me keep these costs down? Or ask, hey, if this is really too expensive for me, is there another drug, that doctor that you recommend, that could be a more affordable option for us to consider? Again, you're not the doctor, you can't self-medicate, but you can ask good questions and use your doctor as a partnership to help best facilitate your care. Wonder if we have any other questions or concerns on here at this particular time. It does not really look as though that we have a bunch of questions at this particular time. So once again, I just want you to know that we are here for you. I'm Monique Zinn with Zinn Insurance Agency. We would love for you to check out our Facebook page. It's Zinn Insurance. So please check us out. You can also check out our website, www.zinninsurance.com, for updates as well as additional ongoing information that we will have. And our next Facebook Live event will be coming on the third Thursday of the month. We're trying to do these monthly. Thursday at 6 o'clock. It's kind of a standing appointment where we will be diving into new changes that happen in the Medicare world to help make you a better consumer. So hopefully you guys got a little bit of information out of this evening. And if nothing else, if you like the information, give us a thumbs up, share a good comment with us, or if you'd like to see us improve or ask for any additional questions, we'd love to hear from you. Look forward to seeing you, and we appreciate your time and look forward to the information that we will be sending out after the broadcast of this Facebook Live event. So thanks for tuning in. I hope you had fun and learned a little bit of information that you may have not had or thought it was a little bit confusing when you're diving in for the first time, or if you're continuing to get more information on Medicare. All right, be safe, be well, and we hope to see you soon. Take care. Bye-bye now.